This is called body of the pubic bone. Understood? Hello?
Yes, sir.
So how do you call the structure that is over here? But actually it is not there. I'm trying to draw the structure. Yeah? How do you call the structure here? This is called symphysis of pubis. Very good. Very good. This structure is called as what?
Pubic tubercle.
Very good. Thank you. This is called pubic tubercle. You have already. Yeah? So very good. So next comes this opening. How do you call this opening?
It's obturator foramen.
Obturator.
Already written there, yeah. So foramen obturatum, yeah, obturator foramen. So how do you call this bone? How do you call this part of the bone?
Like ischic.
Ischial ramus, yeah. Hey, this is ischial ramus. How do you call this? This is ischial tuberosity. Understood, doctor? Hello. If we have a posterior picture, yeah, so we have what? We don't have a posterior picture. If you had a posterior picture, there will be what? It'll actually somewhere, it will be somewhere here. If the posterior view, there will be a spine. Yeah, ischial spine should be present. Unfortunately, we don't have. So little bit of revision of anatomy. Yeah? So please, before you go for any of your trauma class, it is mandatory. Not mandatory. It's mandatory anyway. Yeah, for you to open your atlases. In Moodle, I have given links to download those books, and we have also books with pictures. Please try to download them. Please independently try to study them for your classes. This is very important for you to grow your knowledge. Yeah, so please. So first of all, any topic in trauma or orthopedics, yeah, first of all, you have to know anatomy of the bones, what muscles are attaching, what things are attaching. This is very important. This makes your class very interesting. So we went through the bone anatomy. So now let's come back to our topic. Yeah, so I told you, yeah, we classify fractures of pelvis into two groups, that is stable and unstable. Criteria is what happened. What happened to the pelvic ring? Damaged or not damaged? So let's try to think. Patient has a fracture of iliac crest. Is it stable or not stable?
Stable.
Stable, yeah. It's not affecting the pelvic ring. Yeah, very good. So now patient comes to hospital with fracture of inferior pubic ramus. Stable or unstable?
Stable.
Stable. One more patient come to hospital with bilateral, yeah, both inferior pubic ramus damage. Stable or unstable?
Unstable.
No. It is still stable. Yeah, superior pubic ramus is there. It is maintaining your pelvic ring. Yeah. Now patient came to hospital with fracture of superior pubic ramus. Stable or unstable?
Unstable.
No.
Stable.
Still got inferior pubic ramus. Yeah. So it will maintain the pelvic ring. Understand, doctor? Pelvic ring will not break into two half. Understood? Understood. Hello.
Yes, sir.
If patient come to hospital with damage of both superior and inferior pubic ring, what will superior and inferior pubic ramus, what will happen?
Unstable.
Unstable. Yeah. In this case, the pelvis will open up. Understood, doctors? Hello. Understood.
Yes, sir.
Yes, sir.
So we know the fundamentals, how to classify a fracture as a stable or unstable fracture, because our tactics of treatment of the patient depends upon our understanding. Is it a stable or a unstable fracture? So stable, understood, stable. Yeah. Unstable has two variants of instability. What are the two variants of instability? Let's try to. There are two variants of instability. Patient can have horizontal instability, or patient can have vertical instability. Understood the word horizontal? That means after the fracture, the pelvis will go laterally. That is called horizontal instability. Vertical instability that we can see over here, right? Vertical. That means what happened after the fracture, the pelvis, this part of the pelvis is going to go up, maybe the other part is going to go down, maybe. This is called as what? Vertical instability. Understood, doctors?
Yes.
Hello? Am I clear so far? Hello?
Yes.
Any doubts so far in what I explained?
So can you repeat that part again, please?
Okay. So once again, we have two types of instability. what it can be. Let me clear everything. So one is horizontal instability. That means imagine fracture happened in this region. Fracture happened in the place of what? Rupture of what? Symphysis pubis. So because of that, what happened? Pelvis is going to open like a book. Yes or no? It's going to open. It's going to go out and open like a book. Yes or no? So this is called as what? Horizontal instability. Opening, moving towards the side, laterally like that. You can remember. This is called as what? Horizontal instability. Understood? Hello?
Yes, sir.
Next variant after fracture. Imagine fracture happens in the sacroiliac joint, maybe in this region, maybe, or maybe fracture happened in this part of the iliac bone with rupture of what? Superior pubic ramus. So when a fracture happens like this, after this, what happens? Maybe this fragment is going to move up, and this fragment is it's going to stay in its one place. Actually, this is going to stay in its one place. This part can move up. So what happened? The pelvis displacement happened vertically. Yes or no? This is called vertical displacement. Understood? Hello?
Yes, sir.
Yes.
So someone asked me the doubt. Is your doubt clarified?
Yes, sir.
Okay, thank you. So, when you look at pelvic fracture, this thing should run in your mind. First thing, you should orient yourself. You should ask the patient and know the mechanism, what happened, in what scenario the patient got the trauma. Next thing, this one can be assessed only in the X-ray, and also we can do also clinically also. To think, is it a stable or an unstable fracture? We can examine clinically. We'll look through it now in a while, and we also can confirm it by X-ray. So for you as orthopedician, or for you as a future doctor, when somebody comes with pelvic fracture, in your mind should run, and you should think, is it a stable or an unstable fractures? Okay, so let's continue to the next thing. So some variants of unstable fracture is what happens. This butterfly fracture is an unstable fracture. This opens like a book also, or open book fracture is also an unstable fracture, in which what happened? Pelvis will open like a book. So two variants, some names, very common names that I gave you. So next thing, fracture can also happen to, you can go to AO surgery reference that is given in your class topics, where you can go in detail study about subclassifications of what your unstable fracture, which is not necessary for you all. For you all to know the fundamental, that is more than enough. Next thing that we should understand also, what can happen to this acetabulum. So what can happen to the acetabulum? Acetabulum can have a complete fracture or incomplete fracture. So let's once again go back to the picture that is over here. Sometimes patient fall from a height, landed on one of the lower limb. So force can go from the lower limb. Wait, let me draw. Force can go from the lower. Sorry, oh my God. I'm not good in drawing. So force can go from the lower limb like this. Imagine the lower limb was there. It will go from the lower limb in such a way. What happened? It is going to damage. It will cause what? Fracture of what? Roof of the acetabulum. The roof of the acetabulum will get damaged. And what happened? Head of the femur will go dislocate posteriorly. Understood, doctor? Understood. So fracture can happen to the roof of the acetabulum. And what happened? It can go up. This is one variant. So fracture of roof of the acetabulum leading to a posterior superior dislocation of head of the femur. This can be a variant, so that we can see already. So it can be a complete or an incomplete fracture. So when it is complete, what happened? With displacement. When it is incomplete fracture, there is no displacement. The second variant is what happened? Fracture with dislocation of the thigh bone. I gave you one variant. Is what happened? Fracture of roof of the acetabulum. And what happened? Head of the femur went posterior superiorly. There is one more variant where what we can see in the mechanism of injury just now we saw in the picture. 1 minute. So we saw over here in this picture. So the thing is that what happened when there is fracture of acetabulum, especially when we have blow from the side. So when there is blow from the side, so what can happen? Here we'll have the head of the femur. So So it leads to fracture of what acetabulum, and what happened? Head of the femur will come inside the pelvic cavity. This is called central dislocation. So central dislocation of head of the femur will happen only when there is fracture of acetabulum. So you should think about these two variants. So what can happen to acetabulum? Acetabulum can have a complete fracture or incomplete fracture. So complete means what happened with displacement for sure. If it is incomplete, there is no displacement here, followed by what happened? Dislocation of the thigh bone. Yeah, so it can go posterior superiorly or centrally. So these are all injuries to the acetabulum. So in general, what happened? These are all fundamental classifications of what your fundamental classification of what? Analyzing what happened? Fractures of your pelvis. So for any question, doctor, in classification or fundamentals? Hello? Any questions so far?
No, sir.
Okay, so let's go to the next step. So the next step contains our compliance. So patient will have its own typical complaints. We should take anamnesis, yeah, and we should look at what happened, condition, local examination, yeah, and we have to give first medical aid to our patient. So let's see what patient can complain of. Patient can complain of pain in the abdominal region, yeah, maybe pain and inability to move the affected limb.